You may recall that during the last special session, lawmakers passed a budget that largely shielded the state's Department of Health from cuts. But that may not be the case this time around as lawmakers consider shifting priorities. Capitol correspondent Harrison Golden, you're up next. Unpack all this for us, please.
All right, Fred, happy to do it. The House Appropriations Committee is mulling over non-revenue ways to slim gaps in programs like corrections, TOPS, and higher education. And for that, the panel may just take from what some conservatives are calling a ballooning LDH.
I just don't know that the state can keep up. And I don't know how much we want to every year say we have to either raise revenue or reduce everybody but LDH.
The budget state lawmakers passed earlier this month would fund Louisiana's Department of Health at $14 billion. That's $63 million more than the current budget year.
At some point in time, we have to either say we're going to raise revenue every year or we're going to do something to control this.
The newfound focus on opening up LDH funds comes as Republican House members claim the department did not disclose nearly $67 million in savings until just earlier this month.
Knowing we had this money out there, we might have done something differently.
Yes,
and that's the part that members are frustrated with. And then are there any other pots of money out there?
But LDH officials said that money was mentioned in previous versions of the budget, dating back weeks before the last session.
There's something in this adjustment that everybody can hate and everybody can complain about, but this is our best estimate right now and where we're at and what we think the program will cost here in state fiscal year 19.
Despite those savings, health officials and House Democratic leaders say it would not be enough to protect programs like Medicaid if lawmakers were to send their revenue elsewhere, owing the department's growing needs to a nationwide medical inflation.
Any attempt to not fund those things by the legislature results in you having to make reductions elsewhere in the LDH budget.
That's correct.
And so that means you have to go looking for other services to reduce or eliminate.
That's correct, yes.
And whether the House full GOP-led panel will agree there with what Representative Leger had to say, that's going to be up to when they put the supplemental bill to a vote. And of course, the date on that, or the results of that, remain unknown. The vote set to happen tomorrow night when House Ways and Means Committee members advance tax measures to the full House. And of course, lawmakers have until next Wednesday to figure all of this out. For your local election headquarters, I'm Harrison Golden.